Thank you. Thank you, Mr. Chairman.
Thank you. Senator Thune.
Thank you, Mr. Chairman. Secretary, earlier this year, a number of colleagues and I sent a letter requesting that you rescind a rule that requires everyone in Head Start facilities to wear a mask, including children 2 years old and older, even when they're outside on the playground. Though there is an injunction against this rule in several states, the rule has yet to be withdrawn. As the administration plans to drop Title II public health measures at the border and continues to modify other recommendations, why hasn't HHS decided to rescind this Head Start rule?
Senator, thank you for the question and your interest. Most of those kids in Head Start haven't had a chance to get vaccinated. There are still families that are very afraid of what could happen to one of their loved ones. Those who say that children don't get COVID should talk to the hundreds of families across America who've lost a child under the age of 5 as a result of COVID. We are driven by the science when it comes to the work that we do on COVID, and we will continue to do everything we can to make sure we're protecting every human life in America, including our children.
The transmission of COVID-19 is really low among kids, particularly young kids. And it seems like masking toddlers on the playground seems completely unnecessary. And I would say that even the World Health Organization has concluded that there isn't any particular benefit, health or safety benefit, to masking kids under 5, and especially when they're out on the playground. I mean, it just it just seems to me, at least, when you're outside and kids are playing, we know there are impacts, adverse impacts to masks when it comes to their socialization skills and to their learning skills. But it just seems like when you even have the World Health Organization saying that masks for toddlers or for children under 5 isn't necessary, that we are really creating problems that don't need to exist. So let me ask you this. When do you foresee that rule being rescinded?
You're talking about the public health emergency or the masking?
Masking, yeah.
So the masking requirements and the instructions on and guidance on that are, as I mentioned, are driven by the science. When our scientists tell us that there are needs to take precautions because masks have been proven to be safe and effective, we issue those guidance, sometimes requirements to move in that direction. Once we see that the need for those types of protections are no longer necessary, are no longer there, we will move forward in trying to make the adjustments. But while there's a chance to provide the most safe and effective way to keep a loved one alive, we're going to do that.
Well, again, I mean, not to overstate this, but it does, I think, to me, it just seems illogical, and particularly given when you weigh the consequences of the impacts on these kids, the negative and adverse impacts on these kids from wearing masks all the time, relative to when you try and weigh this, it's on the scale. It just seems like it clearly comes out on the side of common sense dictating this. I understand you're wanting to follow science, but you do have some scientists. You have the World Health Organization telling you that masking for children under 5 isn't necessary. And so it strikes me, at least, that this is one of those requirements that is just a real overreach at a time when parents, a lot of parents at least, and a lot of kids are struggling and struggling with learning. They've gotten behind, and I think a lot of it has to do with associated with the impact of masks and their ability to socialize with other kids, and also to to be able to learn at the fastest rate possible. So I would just I urge you, encourage you, given where we are with the pandemic, that this is one, particularly when kids are on the playground, when they're outside. That makes no sense to me. Very quickly, because I don't have a lot of time, but we talked last year at the budget hearing about departments' authority and resources to ensure the advancement we've made on telehealth during the pandemic, that those aren't lost. And I see again that this budget doesn't describe administrative actions the department plans to take on Medicare telehealth, nor does it include a full legislative proposal for Medicare. There is a single reference to extending pandemic flexibilities, but we need data, we need details on what you can and plan to do administratively so we can focus our efforts accordingly. And it would help to have more certainty on the expected length of the emergency for sure. But can you tell us some specifics on what you foresee the department doing administratively on Medicare telehealth at the end of the emergency?
Absolutely, Senator. Let me start by saying first, thank you for extending for 5 months the authorities we have on telehealth. We'd like to work with you to extend coverage for services for patients to be able to use their home as the originating site for that healthcare service. We'd like to continue to offer those federally qualified health centers and rural health clinics the ability to provide the services from distant sites. We'd like to move towards payment parity for behavioral health telehealth services so that we can continue to have providers willing to do that, that there's strong evidence that telehealth has been effective or just as effective as standard in-person treatment in parts of the country. We'd like to be able to do audio-only access for patients whose circumstances would necessitate that they get audio services instead of having to worry about trying to reach a particular provider in person. So there are a number of things we'd like to do. Again, with the authorities that you could grant us, we could try to keep those extended services in place.
Yeah, my time's expired. Thank you, Mr. Chairman.
Thank you. Senator Whitehouse.
Thank you. Welcome, Secretary. Good to be with you. A couple of quick topics. First, the most significant issue that our Rhode Island hospitals are facing right now is nursing and healthcare workforce. And this has two dimensions. One,